Hello, everyone. My name is Camille Gillette, and it's my pleasure to welcome you to our Health Informatics Industry webinar. I know you all have very busy schedules, so I just wanted to take a few moments to thank you for taking time out of your schedule to join us today. Presenting with me today is my colleague, Megan Johnson, and we'll also get to meet an esteemed member of our faculty, Dr. Spyros Kypsou. In today's webinar, we will cover program administration. We'll review our health informatics programs briefly. We'll also talk about industry trends within telehealth. And at the end of the session, we will also have a Q&A session. So please utilize the chat box, which you should be able to see on your screen, at any time to enter any questions you may have, and we'll be sure to cover those at the end of the presentation. Our program administration includes Dr. Larry Paola. He's Head and Director of Graduate Studies here at the university. Dr. Mike Dieter is Program Director for Health Informatics, also a Clinical Assistant Professor. Dr. Spyros Kypsou, which we'll hear from today, is our guest speaker. He's an Assistant Professor. And our student advisors are Rosanna Juwan and Jennifer Snedden. Here at the University of Illinois, we offer two health informatics programs. One is the Master of Science in Health Informatics, which includes a research track as well as a non-research track. And the research track is really ideal for individuals who want to take their knowledge of health informatics a step further and analyze healthcare or any clinical related problem and produce a solution. The Masters in Health Informatics program requires a minimum of 45 credits and is typically completed within 2.5 years. The Postmaster Certificate in Health Informatics is an 18-month program which has 7 courses. The minimum credits required for that is 24. Now, our health informatics programs are interdisciplinary. It encompasses informatics for all major areas in the healthcare industry, including, but of course not limited to, nursing informatics, pharmacy informatics, public health, clinical, medical data research, and analysis. Our health informatics programs are ranked as one of the best in the country. We're also one of the oldest programs. We're also accredited by an organization referred to as CAHEM, which stands for Commission on Accreditation for Health Informatics and Information Management. With our health informatics programs, students not only learn how to design, develop, implement, and evaluate electronic health record systems, but also how to analyze this data and turn this data into meaningful information that can be used for improved outcomes. Now, our graduates are able to identify trends within the healthcare industry. They learn how to communicate the results to those making the decisions that affect the health of people in our communities. So with that being said, we'll learn today more about trends within the telehealth sector. And we'll get to hear from our guest speaker, Dr. Spyros Kypsou, who is an assistant professor in biomedical and health information sciences here at the university. That department is often referred to as BHIS or BHIS. He's an associate fellow researcher, Canada Research Chair in Information Technology in Healthcare, and he's also authored and published peer-reviewed articles in leading health informatics and information systems journals. Dr. Kypsou?
Thank you, Camille. Good afternoon, everyone. Thank you for your interest in our master's program and for participating in this webinar. My name is Spyros Kypsou. As Camille said, I'm an assistant professor in the BHIS department at UIC. My current research focuses on the development and evaluation of e-health and mobile health interventions for managing patients with chronic diseases, as well as the evaluation of the impact of electronic health records in healthcare settings. So in my presentation today, I will talk about the role of telemonitoring technologies in managing patients with chronic conditions and their impact on health and structural outcomes. I will present to you the main aspects of the research on home telemonitoring that we are conducting here at the BHIS department in collaboration with colleagues from other departments and universities. And I will also talk about the opportunities for student participation in these research studies. Camille, can I control the presentation?
Yes.
Okay. Continued advances in science and technology and general improvements overall in environmental and social conditions, as you already know, have increased life expectancy around the world. As a result of that, the world's population is aging and the proportion of the elderly people requiring care is increasing. This has major consequences and implications, of course, for all facets of human life, including health and healthcare. Indeed, as we age, the incidence and prevalence of chronic diseases continue to rise. So as shown in this graph, between 2010, right here, and 2030, the number of Americans with one or more chronic conditions will rise 18%, an increase of approximately 30 million people. And this increasing prevalence of chronic diseases as the population ages is placing an unprecedented strain on our healthcare system, including our hospital resources. Chronic diseases are, for those who are not familiar with the term, chronic diseases are those that can only be controlled and at present not be cured. They include diabetes, for example, cardiovascular diseases such as heart failure, chronic obstructive pulmonary diseases, asthma, and of course a range of other neurological disabling conditions that have a profound impact on a person's quality of life and on their family. So these chronic illnesses are basically driving up healthcare costs at an alarming annual rate and have become major causes of death in almost all countries. According to the World Health Organization, in 2008, 36 out of 57 million deaths, almost two-thirds, were due to non-communicable diseases. In the United States alone, chronic diseases cause 7 in 10 deaths each year, and about 133 million Americans, nearly 1 in 2 adults, live at least with one chronic illness. So the prevalence of chronic diseases is also one reason why expenditures in healthcare are skewed. Currently, in most healthcare systems, about 5% of patients are responsible for approximately 50% of costs. And patients with a chronic disease or complications usually account for more than 60% of hospital bed days. So the long-term and disabling symptoms that often come with chronic diseases decrease the overall quality of life and, of course, have major consequences for the patients and their families. They create loss of income, mental and physical stress, depression, and so on. At the same time as we face dramatic changes in the numbers of chronically ill patients, there are also global provider shortages. This figure presents the average number of physicians with a blue collar and nurses in red per 1,000 people in different countries. So as it can be seen here, developed countries such as the United States, United Kingdom, and Canada suffer from an acute shortage in terms of physicians and nurses, and there's no realistic prospect that this situation will actually change in the near future. Some countries have to cope with reductions in the number of persons entering the nursing and medical profession, and several studies have suggested a substantial physician shortage, which is expected to develop in the coming years in various countries. Oops. So overall, there's a pressing need for, I would say, health IT solutions. These dramatic increases in the numbers of chronically ill patients in the face of population aging and provider shortages, as well as significant cost pressures that we're going through, mean that fundamental changes are required in the management and delivery of patient care. There is a huge need to identify new patient management approaches that will actually ensure appropriate monitoring and treatment of patients while reducing the cost involved in the process of care. There's also a need to identify effective self-management interventions that will educate and support patients become active participants in their own care. So altogether, health informatics solutions involving the effective design, application, and use of information and communication technologies can actually play a crucial role in supporting the management of these chronic conditions. Specifically, mobile health and home telemonitoring technologies, which have been growing dramatically over the years, can potentially move certain healthcare services away from the hospital to actually help reduce the resource burden associated with readmissions and the overall management that is required within the chronic diseases of the patients. So telemonitoring, I'm not sure if all of you are familiar with the term or if you have heard about telemonitoring, but it is a form of non-invasive remote monitoring that has gained a lot of attention in recent years as a promising strategy to improve the care and management of patients with chronic conditions. It can be particularly helpful for those living in remote and rural areas, the elderly, of course, and frail who are housebound, as well as those at high risk of deterioration. As shown in this figure, home telemonitoring right here involves the actual use of sophisticated systems and remote access technologies, for example, telemetry devices, handheld or wearable technologies, and intelligent sensors. For the digital transmission of physiological and other disease-related data from the patient located at home to a healthcare center providing care. By allowing clinical data to be remotely collected by clinicians on a regular basis, these home telemonitoring solutions and, of course, mobile telemonitoring applications can enable early detection of clinical decompensation, allowing for timely intervention to prevent events such as mortality or further deterioration of the patient's condition, necessitating hospitalization, ER visits, and use of excessive resources. So there's a large variety of applications, devices, and communication technologies that are used in remote patient monitoring, and as a result of the continuous evolution and growth of ICT, we see a lot of new solutions, new IT technologies being developed. These range from simple solutions, such as the first one that you can see in this slide, standalone video conferencing involving synchronous nursing consultations with patients, or video conferencing that is integrated with transmission of some simple vital signs such as heart rate, and it goes to more sophisticated forms of telemonitoring. For example, telemonitoring of physiological parameters through the use of non-invasive patient-initiated telehealth devices that have the ability to measure vital signs and automatically transmit data through a hub, modem, or broadband connection to a central server accessed by clinicians. Other forms of telemonitoring include interactive response systems, which enable the collection of symptoms-related data either through the use of specialized telehealth devices that look like pagers, or the use of voice response systems, which actually require the patient to dial in a toll-free number and enter health-related data in response to questions by using the telephone touchpad. Some of these interactive response systems can also be integrated with peripheral devices such as glucose meters, weight scales that can send through Bluetooth data to the telehealth station, blood pressure monitors, and other peripheral devices allowing data collection, transmission of disease data. And last but not least, mobile telephones can be used to facilitate physiological monitoring of vital signs at any time and any place. They can allow delivery of short messages, education sessions through smart apps, and of course direct calls to individuals to improve outcomes and self-care regarding diet, medication, and exercise. Nonetheless, the effective use of these mobile health apps and home telemonitoring devices as well as other health informatics interventions, all together present enormous challenges. For most, they require developing and testing new models of care to overcome several usability shortcomings and human factor barriers. So here within the BHIS department, in collaboration with faculty and researchers from other UIC departments, colleges, and universities, we conduct research studies with a view to providing patients, policymakers, and clinicians with the evidence they need to make informed and evidence-based decisions. So the main questions overall we're trying to address are, is home telemonitoring effective in reducing, for example, mortality, readmissions, and costs? And who's benefited the most from these interventions? We're also interested in looking into if there's a differential effectiveness between home telemonitoring strategies and the technologies used, and we're looking, of course, at the cost effectiveness of these type of interventions. Now, the main focus of our research are usually patients with heart failure, hypertension, diabetes, chronic obstructive pulmonary disease, and asthma. In this context, our current and, of course, future research agenda at BHIS revolves around conducting clinical studies such as randomized controlled trials, cohort studies, and also we're interested in conducting what we call health technology assessment and evidence synthesis reviews that can support clinicians and professionals in evidence-based decision making. Personally, I'm sorry. One too many, I guess, over there. So personally, I have a keen interest and experience in conducting systematic reviews of effectiveness as well as meta-analysis of RCTs, and currently I'm working on several reviews to investigate the effects of various home telemonitoring interventions on patients with chronic diseases. So one of the reviews that we just finished, is geared towards patients with heart failure. More specifically, my collaborators from the Canada Research Chair in Information Technology and Healthcare and I recently completed a massive overview of an evidence synthesis of 37 RCTs, 67 observational studies, and 18 systematic reviews with a view to identify the clinical and structural effects of home telemonitoring on patients with heart failure and try to inform policymakers, researchers about the gaps that exist, and of course healthcare professionals about best practices. This research study pulls together 17 years of home telemonitoring research with the main outcomes of interest being, all-cause mortality, all-cause hospitalizations, heart failure-related hospitalizations, cost-effectiveness, quality of life, length of hospital stay. Currently the results of this study are under review in the top journal in the field of health informatics, namely the Journal of Internet Medical Research. So based on the evidence synthesis we performed, we concluded through this study that home telemonitoring strategies reduce the absolute risk of all-cause mortality. We saw important effects there in patients with heart failure. We saw a reduction of approximately 2 to 6.5%. It ranges from one study to another, and of course, positive effects on on the risk of HF-related hospitalizations. Reductions range from 3.7 to 8.2%. Patients who have been recently discharged from an acute care setting and are at high risk of rehospitalization or sudden death appear to benefit more by these home telemonitoring solutions. However, these favorable effects are based on moderate to low quality of evidence due to risks of bias and, of course, the small size of the studies that have been conducted up to now. And there's overall, we saw that there's a need for future studies to identify which actual home telemonitoring strategies provide optimal outcomes, under what circumstances, and of course for which patient subgroup. There's a need to, for future studies to identify, which home telemonitoring strategies are better, and we need to adopt actually multidisciplinary methods capable of untangling the often complex set of factors that influence the effects of home telemonitoring. Remember, these are complex interventions that involve numerous procedures, healthcare professionals, monitoring of several vital signs, and of course an integrated model of care in place. And this is just to support usual care and the doctors, not to substitute the standard care that's provided through the hospital. So as faculty members of the Tier 1 research universities, UIC is a Tier 1 research university, and because of the research we're conducting, we're able to identify various gaps and opportunities for student projects and future research studies that can give students the opportunity to advance their knowledge and skills while also addressing enduring or current organizational problems, challenges, and dilemmas that are relevant and tend to be well received by practice. Just as an example, last week I met with one of our graduate students from the research track program in health informatics who was interested in studying more about the use of mobile health applications and do her thesis on a relevant topic in that area. And given my prior involvement and experience in mobile health, together we were able to identify with her a relevant topic for her thesis that matches her background and professional aspirations, allowing her to develop new skills and knowledge in this area. So she will be conducting a systematic review of a number of clinical trials to investigate the effects of mobile telemonitoring interventions only versus usual care for patients with type 1 and type 2 diabetes. So this project altogether will allow her to develop expertise in searching multiple databases for identification of published randomized controlled trials, gain proficiency in extracting both quantitative and qualitative data from trials using standardized forms and other methods, develop new knowledge and practical skills in using meta-analytic and evidence synthesis methods, and overall engage and collaborate with experts during the process in the field of telehealth and mobile health, which is particularly important. So in the Biomedical and Health Information Sciences Department, we strongly believe that teaching and research are interdependent elements, and as a faculty member, I always bring my research into the classroom and carefully discuss it with my student. I think that this exchange of ideas benefits basically everyone, and I encourage student research or student participation in research studies because it helps graduate students become even more enthusiastic about health informatics, gain important professional skills and knowledge that are of vital importance in the industry for successful professional career. I will thank you very much for your attention. I will be accepting questions through the chat tool that we have available for you.
Great. Thank you, Dr. Kitsu. And we'll definitely be answering some questions, and on your screen you will see the contact information for your enrollment advisor, so feel free to make a note of that and reach out to us so we can discuss any personal situations that you may have. One of the questions that was typed in is how experienced is the UIC faculty? So our faculty are truly distinguished experts. They have experience as clinicians, business executives, consultants, they're researchers, published authors, lawyers, so a very, very excellent background that can really impart some really, really great knowledge on our students. Another question was, can I start in the fall? Absolutely. We are accepting applications for both summer and fall of 2015. So feel free to reach out to us if you have any questions. And another question we have is why UIC? I'm going to pass that one over to my colleague Megan.
Yeah, absolutely. That's a great question. So as Camille mentioned earlier in the presentation, the University of Illinois at Chicago has the third oldest informatics program in the country. And as she just explained, some of the backgrounds of the faculty and staff that we have here with the program. Dr. Kitsu actually touched on this briefly as well. There's a high level of interdisciplinary collaboration within the university, which is not necessarily always the norm. It's something that's a wonderful thing to be a part of a program like the Health Informatics program. Your faculty can be collaborating with faculty across our other colleges of study within the healthcare field, and because it is an R1 research institution, the faculty are also typically involved in research that extends outside of the doors of the university itself. Sometimes research initiatives are actually undertaken between a collection of different universities, which means that the faculty that you're receiving instruction from are exposed to a broad range of the ongoing topics within the healthcare industry. Camille also mentioned RKHIM accreditation, of course, and the benefit of that is that with a program that is accredited by that commission, the curriculum does have to meet certain standards. So you know that the coursework that you're taking is actually meeting the requirements to show that it's relevant to what's actually going on in the field.
Great, thank you, Megan. So another question that we have is, do I need to come to campus for any reason? So the program is 100% online. The only time you will need to come to campus if you choose the research track, which is something that you really have a lot of time to decide on. And also with the master's program does have a practicum option. That does not require that you come to campus, but that will require for you to actually go to a site in your area. So those are the only times where your coursework would not be online. And definitely we can discuss the practicum in more detail with you if that's something you have an interest in. Another question that came through was the admissions requirements for the programs. So for the master's program, we do look for a 3.0 minimum GPA as far as your undergraduate is concerned, and it needs to be from a regionally accredited institution. And we do look for at least 2 years of relevant work experience. With the postmaster certificate, the admissions requirements are the same with that 3.0 GPA with a 2-year work experience. And of course, for the postmaster certificate, you will need to have a master's degree or higher. All right, so we received another question regarding graduate outcomes and employability with a career. We actually surveyed our 2013 graduates. We'll be having the numbers here for the 2014 graduating class soon, but with the 2013 graduates, they were all working in the field of health informatics. 64% actually earned a salary increase after completing our program, and 79% were actually able to advance their careers after completing the program. So our graduates do very, very well. And another question was, do we need to complete the program within the 2.5 years for the master's? So for the master's, we do give you up to 6 years to complete the program. For the postmaster certificate, which is an 18-month program, you do have up to 3 years to get that completed. So there's a lot of flexibility built into the program. Another question was, can someone do this program only with an IT background? Certainly. Our student population has a very diverse background. We have people that are IT executives or IT backgrounds that are in the program. And again, we have the clinicians. We have the pharmacists, the physicians, the nurses that don't have such a strong IT background that do very well. So this program does a really great, it really blends IT, business, and healthcare really nicely, giving you a really rounded knowledge of the field of health informatics. So an IT background is not required or necessary, but it definitely is a great fit for people that have an IT background. And another question was, how do I get hands-on experience? So for people that are wanting to get into the field of informatics and has not been introduced to that, the practicum is definitely a great asset to help you with that. It's a 160-hour practicum where you would actually work in a health informatics department in your area. And you're welcome to select a site. And if you need assistance with that, you will work closely with your student advisor, which is Jennifer or Rosanna, to help get that scheduled. All right, so another question is, how relevant is the program to biological research? And I'm going to go ahead and see if Dr. Kitsu can answer that for us.
I would say with biology, I mean, we have to be a little bit careful because there are other programs, you know, bioinformatics I would say is the most appropriate program for this. Although we do touch upon biomedical aspects and informatics, if someone is interested in just biological, I mean, the design, you know, implementation and use of applications that can support analysis of, you know, that is related to biology, then, you know, our program is not really geared toward that direction. Although, you know, it includes biomedical aspects, of course. You know, I would strongly suggest for someone who wants to get a bioinformatics degree to also look at the other program that UIC has in this particular area.
Thank you, Dr. Kitsu.
You're welcome.
All right, and we're just looking through for additional questions that you may have. Another question is, how recognized is the program outside the U.S.? What I can tell you is that we get a lot of interested international applicants on a daily basis. So our program, I would say, is really world-renowned. You know, we get a lot of interested applicants that are physicians and have a variety of different backgrounds worldwide. One question is, do we feel that health informatics will remain in high demand? And HIMSS actually did a survey which shows that the career outlook is really, really growing, where it's projected that the demand for this career is supposed to grow by 20% from now through another 10 years or so. So right now what we're seeing in the industry is that there's so many positions that go unfilled or really stay unfilled for quite a long time as it relates to health informatics. So a lot of universities are starting to offer this program, but one of the things that sets us apart as UIC is that, you know, our program is so well established, has been around since the 90s, and again, the KHIM accreditation that we have is really, really huge in this industry. So absolutely, the demand will certainly continue for health informatics professionals. Okay, another question for you, Dr. Spirous, is can you elaborate a bit more on the relevance of clinical trials?
With respect to home telemonitoring, I guess, or just overall?
Yes, either is fine.
Okay. Well, randomized controlled trials are the, you know, ideally the best possible design we can have when we're assessing, you know, a number of interventions. So in our case, we're in the process right now of designing a new clinical trial to assess mobile health app, you know, with our collaborators in Canada, and I mean, these RCTs, as we call them, you know, they're always complex. They're very, of course, it's difficult to recruit patients. They take a lot of time, but they're very rewarding, and their results, of course, have an impact on clinical guidelines. So, you know, in the research track, as I said, I have a student who's working on a project on assessing the effects of mobile health by looking into different randomized controlled trials. And I believe that students, when they become involved in this type of research project, they get a great appreciation of how trials conducted, how we can minimize bias, how we can effectively allocate patients into the different groups, and of course, you know, ask relevant questions in terms of outcomes and how we do analyses and so on. I don't know if that covers the question of the person that asked, or would you like me to elaborate more?
I think that was really good. Thank you, Dr. Spiros, Dr. Kitsu. So another question was related to the cost of the program. So for the postmaster certificate and the master's, the tuition is $735 per credit hour. The tuition will vary between the two. For example, the master's program requires a minimum of 45 credits, whereas the postmaster certificate does require a minimum of 24 credits. Now, as far as payment options, we accept a variety of payment options, whether that's a payment plan, which you can set up through the university, or you may use tuition assistance or tuition reimbursement offered by your employer. Of course, military benefits are accepted. For those that may have financial aid, you can certainly apply for that as well. Yes, we do see retail pharmacists in our program. That's another question. So our student body encompasses retail pharmacists, PharmDs, those in the hospital sector. We get consultants, physicians. Again, we have people with a business background. You know, we have people that are in finance. So it's a very diverse group of individuals. Of course, nurses are in the program as well. So the key is to have 2 years of related experience. And if you have questions regarding whether your experience would qualify, certainly reach out to one of us, one of the enrollment advisors. Okay.
So another question that we received is, what is the difference between the different types of informatics? Dr. Kitsu mentioned the relationship between biology and biomedical informatics in response to one of our previous questions. So the difference is really based on a couple of things. It's based on what the programs cover, and it's based on what the goals of the application of the program is once you've graduated. So our program is Health Informatics. Camille has mentioned, and we've talked a little bit about how it's a multidisciplinary and multi-professional program, meaning that we have nurses, physicians, and pharmacists, folks from the clinical side. And we also have folks that have IT backgrounds, both health IT and just IT outside of healthcare, health information managers and directors, lawyers, consultants, sometimes even accounting professionals. With a health informatics program, you're going to be exposed to professionals from all different areas of informatics, as well as a curriculum that speaks to all the different uses of informatics, whether that's within a hospital setting, a nursing setting, a public health setting. Various other types of informatics tend to pinpoint a particular industry or a particular set of jobs. So, for example, nursing informatics would be more of a nursing program with an informatics focus for nurses. Biomedical informatics deals a little bit more with the biology or with the machines, computer algorithms, and things like this. We feel that one of the benefits of you being involved in a health informatics program is that you do have that exposure to the multiple professions you would encounter in a real-world setting, and that can help to increase your job opportunities. So hopefully that answers that question.
Great, thank you. Another question we had was, is it hard to get into the field of informatics or health informatics with no professional work background in that field? It's definitely not difficult to do that. Our program does prepare candidates very well for career opportunities in the field. And the practicum that we offer is also a really great way to garner additional experience in the field and, of course, to market yourself to what could be a potential employer. We do have a career services department that you could reach out to as well. So there's a lot of support from the faculty and the staff here at the university to assist you in not only preparing for your career, but also to help you get your foot in the door, whether it's through the practicum or some other measure.
So one of the other questions that we received was about how having a postmaster's program, postmaster's certificate could put somebody in an advantage if they have a master's degree in with a different background, for example, a master's degree in finance. There are actually quite a few questions about the postmaster's program, so we'll try, as Camille has mentioned, to get through all of the questions today, but if it's an individual, specific question, we will absolutely be contacting you one-on-one as your enrollment advisors. But to answer the question about the postmaster's certificate versus the master's, we like to say that it kind of depends on your comfort level. The postmaster's program has about half the number of classes that the master's does. So could the postmaster's certificate assist you if you have a master's degree in another field? Absolutely. But some of that's a matter of personal preference. We find that a lot of our applicants who have backgrounds in fields that aren't directly in healthcare do feel that they get more exposure to more topics in health informatics by completing the master's. Again, that's kind of a personal preference question, and we'd be happy to talk with anybody one-on-one about the postmasters and what some of those outcomes are.
Great, and another question that came our way was the postmaster certificate, can the credits from that be transferred into the master's program? And absolutely, you can certainly speak with your student advisor about getting those credits transferred into the master's if you decide to make that transition, as long as you do that before you complete the postmaster certificate. Another question is, what is relevant work experience? So obviously this is pharmacy experience, such as working as a pharmacist or a nurse or a physician. But also, if you're an attorney or if you'd held a managerial role in the healthcare sector, such as, you're an RHIA or something similar to that, that would qualify. So any type of high-level IT or business or healthcare experience would be considered. And again, if you have questions regarding your specific work experience, please reach out to one of the advisors. Another question is how soon can they apply, or what are the application procedures? We're accepting applications now for all of 2015, so you can certainly reach out to an advisor who can actually send you a checklist with the items that you would need to apply. It's a very simple process, so what you would do is you would complete an online application, and then you'll need supporting documents such as your resume and transcripts from your prior schools, and letters of recommendation may be required depending on the program you apply for. And of course, you write a personal statement. So there's absolute time to get an application in if you'd like to be considered to either of these programs. Another question was regarding how the online platform works. Classes are, of course, every semester, so you can start in the summer if you'd like. But typically, students will take 2 to 3 classes per semester. So if you took 2 classes, you take 1 class for 8 weeks, another class for another 8 weeks. So it's asynchronous classes, so you can log in at any time that's convenient to you. Of course, we recommend that you log in at least every other day so that you stay on track with your coursework. But it's really built to help the working professional manage all the responsibilities or demands of school and work and life itself. Another question is there a certification after the program? So with the postmaster certificate, you won't earn a certification. You'll actually earn the postmaster certificate. Now, if you're looking for a certification, such as maybe a nursing certification or something like that, Typically, a 200-hour practicum is required for that, and we can certainly work with you to help you earn the practicum hours you would need to actually sit for that certification. But if there's a particular certification that you have in mind, again, do reach out to your advisor, and we could guide you as to the best means to earn that certification. Another question is how many students are in our program? So we do have over 400 students in our program. We do have one of the largest programs in the country, and again, one of the oldest. So a very established program with a lot of great individuals for you to network with that are truly working professionals in the field. And another question regarding when classes start. Now, summer classes do begin on May 18th. Fall classes begin on August 24th. So again, if you would like to be considered for either of these semesters, I do encourage you to reach out to one of us, and we can assist you with meeting those deadlines. There's another question regarding prerequisites. If there are any required to start the program, there are no prerequisites that are required before you actually start the program. If there are prerequisites that may be required, those would be determined based on your experience. So again, it's best to reach out to an advisor who can really discuss your background and advise. But you can certainly apply any prerequisites that may be required. You'd actually take that as a part of your curriculum. As far as fees, there are no fees associated with the program aside from the application fee itself, which is $60. Other than that, you'll just have your cost of tuition and cost of textbooks. And there's no out-of-state fee or in-state fee. So we have another question from someone that has over 20 years experience in IT. Again, to qualify for the postmaster certificate, one of the keys is to have a master's degree or higher in order to qualify for that. And again, it's best that we really talk more in detail about your background so that we can best advise us to the right program for you. But 20 years experience is excellent, which would probably make you a good candidate for one of our health informatics programs.
We had another question about submitting application documents and working with your enrollment advisor. So the names and email addresses of each of the enrollment advisors are on your screen. Our names are Joan Ziegler, Megan Johnson, Richard Mercado, and Camille Gillette. Each of you already actually has an enrollment advisor, so some of you have been speaking with us, but some of you haven't. After the webinar, within the next few days, we're going to be reaching out for you individually to get some of the questions answered that are specific. Regarding the question about sending your enrollment advisor your resume, you could absolutely send us your resume. That is actually going to be one of your required application documents for both programs. So you actually would be more likely to be including that into your application when you complete the online application. But again, we will be reaching out for all of you who have questions once the webinar is concluded and sending out a recording of the webinar as well. So we're just going through some of the questions that we've received now. Thank you all for participating so actively. We have quite a few questions, so we're just kind of trying to make sure that we can answer the majority of the questions. We've got just a few more minutes, but we're trying to make sure we can answer the majority of the questions. Again, keep in mind if we haven't been able to get to your question that we will be contacting you to go through your individual questions. It does appear that quite a few of the questions we're receiving are very specific to each individual's background. So again, we'll be reaching out for you on those very specific questions as well.
There's a question from an international student or that is looking to pursue a health informatics program. So it is best that you contact an advisor directly so that we can determine if you'd be considered an international student with us by USC standards, and we can guide you as to what documents would be required for you to be considered to the program.
Another question we received was about transfer credits into the program. Someone mentioned being able to transfer credits in from a public health informatics program. That's a rather individual question. We deal, the admissions committee specifically will deal with those on a case-by-case basis. In general, there aren't transfer credits awarded for the program. If you have taken courses within the Department of Biomedical and Health Information Sciences recently, or courses that are a joint effort between the Department of Public Health and the Department of Biomedical and Health Information Sciences, we can certainly talk more with you. And again, that's a determination made by the admissions committee. But in general, we don't accept transfer credits into the program. For your advisor also, for more specifics on that, will be reaching out to you. Another question that we received is a graduate thesis required? We don't require a thesis for the program. There is a required class called a capstone, and a capstone is a final project that is the culmination of your efforts in the program. It's taken towards the end of the program. And the capstone also involves a presentation, which you can choose to do virtually, or you can choose to come to campus to do. A lot of our students do like to come to campus toward the end of the program and do that. Again, it's completely optional to come to campus. The capstone is required for all students, but you can actually complete the capstone virtually and do your presentation virtually. So we have another question about denial and acceptance rates and grade point averages for the program. The admissions to the program, of course, all decisions are made by the admissions committee. It is on a case-by-case basis, as I mentioned, with transfer credit. In general, the admissions committee does require for both programs 2 years of relevant work experience, as we've mentioned, and a 3.0 or greater. In individual situations where someone did not meet one of those requirements, then your enrollment advisor would be able to talk with you more about supporting documentation or other things that you would need to include within your application. We do not track a denial or acceptance rate. We're an online program, so we don't have a cap. So our number of applicants that begin each semester depends mostly on the applicant pool. Another question we received was, how does the research track differ from the non-research track? A very high-level answer to that is that our research track does contain a little more coursework than the non-research track. The research track also requires some visits to campus because you would be working with a faculty advisor. Dr. Kitsu actually brought up a great topic for a master's thesis, so someone who is interested in doing their final project or interested in participating in the research track might have some of the interests that Dr. Kitsu mentioned with regards, for example, to telemonitoring. If someone chose the research track, it would be someone who would be interested in coming to campus periodically during the program to conduct research with a graduate advisor within the field of health informatics. If that's not for you, that's okay. You can still participate in the 100% online non-research track, the regular core track as well. And as Camille mentioned with the research track, that is something you do not have to decide right away. You actually would apply to be part of the research track a little bit later on.
Megan, if I may add something to that.
Please do.
So for those who are not interested in joining the research track program because they can't be at UIC or they cannot, come to UIC at certain days, they can choose the other program. But of course, within the capstone project, if they are interested in doing some sort of research, there again, we have currently working with a student on her capstone project on telemedicine, and we try to combine the knowledge, she's trying to build on the knowledge that she has acquired through the master program, the courses that she has taken, and we're trying to apply this knowledge to relevant problems that her organization is facing. And I would say, although it's not a pure research project, it involves doing some research there. So for those who are interested in participating in small research studies or doing some kind of research, they can still do that within the non-research track program.
Thank you, Dr. Kitsu.
So we only have a few minutes left, so we're going to try to wrap up with as many questions as we can possibly answer. We've gotten several questions, as I mentioned previously, about background and how background fits into the program. And as with the question on whether the postmaster's or the master's is the right fit for you and which one is more helpful, your background is kind of an individual, that's sort of an individual answer. You don't have to have a healthcare background to be, in general, to be successful in the program. You would, of course, have to be comfortable in working in an online environment because that's how you'll be turning in your assignments. But we do have a lot of students and applicants to the program that come from a non-healthcare background and do very well. We've had some questions about prerequisite coursework as well. If you don't have a healthcare background, you would be taking some prerequisite coursework in your first semester that would help you become more familiar with the clinical side of the industry. So hopefully that answers that question as well. Another question that we got is, how technical is the program? Will we be taking coding classes? So our program is not intended to turn someone into a systems engineer or a coder. Our program is intended to really address the strategy behind using technology to improve patient outcomes and to approach some of the emerging issues in the healthcare sector that Dr. Kitsu has shared with us today. So the program is more related to, as Camille also mentioned, the design and implementation of various systems within the healthcare professions with the goal of using that technology to improve patient outcomes. We generally see informatics as an intersection between the fields of healthcare and IT and business.
Thank you, Megan. And someone with an IT background actually posed a similar question, saying, would they be at a disadvantage not having a healthcare background? And again, as long as you're comfortable working in the healthcare setting, we'll teach you everything you need to know as it pertains to what the clinicians will need and what they're looking for when it comes on to health informatics. So our student body, again, does comprise quite a bit of our IT executives. So definitely the healthcare background will provide that to you in the program.
Camille, may I position myself also in this question about the background?
Yes, please.
You know, just for your information for our participants, when I was doing my master's and my PhD, you know, I had these type of questions. Can I enter this field? I have no healthcare background. You know, my bachelor's degree is in computer science, yet my master's and PhD are in health informatics. So to those who have either a technical background, a first degree in computer science, software engineering, or IT-related degrees, or they might have, they might come from healthcare. They might be doctors, nurses. This program is, you know, it's based on this interdisciplinary, you know, link between these different professions. You know, it's an interdisciplinary field, so there's always room for nurses to learn IT aspects, and for those that have an IT background to learn how health information management occurs, you know, the challenges and opportunities that exist in healthcare and so on. So I would just strongly say that, advise you that, you know, you shouldn't be afraid to come into this this program and perhaps even do a career change for some. It's an excellent opportunity, and it's an excellent program.
Great. Thank you for your insight, Dr. Kitsu. Okay, so we are almost at that time to end the webinar, so we really want to thank you again for taking time out of your schedule to join us today. Again, we are accepting applications for all of 2015, so do reach out to us if you have additional questions regarding the program or how we could help you, and the contact information is listed there for us. Feel free to reach out to us, and we'll be happy to assist. Have a great day. Thanks for joining us.